Hello everyone, I am Dr. Anupama Risbud. I am certified in sensory integration therapy and founder and director of Anubhuti Pediatric Therapy Center, Pune. I have been working with children with autism spectrum disorder since 8 to 9 years, and today I'll be talking about what is sensory integration, why sensory integration is important, and particularly in autism spectrum, how this sensory integration is affected, why this sensory integration is affected. And I'll be giving few strategies to do at home so that child will be regulated throughout the day, child can focus better, and sensory issues can be reduced. And I would like to thank Autism Connect for giving me this opportunity to present my lecture. So now I will be starting my lecture. Sensory integration is organization of sensations by the brain for use in everyday life. We receive great deal of information every moment, and brain receives this information. So what brain exactly does with this information? We are receiving this information from outside of our body, from the external world, and from inside of our body, from our internal world. So brain locates this information, sorts this information, like brain tries to modulate this information, means brain tries to filter out the unimportant information and processes only the important information which is required so that we can interact with the world successfully. Why this sensory integration is important is because we can interact with the world, we can meet the environmental demands successfully in meaningful way, in purposeful way. As you can see in the picture, the brain is receiving sensory inputs from the sensory systems. Brain is organizing this sensory information, and now child is able to kick, the two children are playing, child is able to read. So all this function, the purposeful function, the meaningful interaction in the world is possible because of the sensory integration process. Now we eat food, the food gets digested and it nourishes our body. Same thing applies here. The brain needs continuous supply of sensations to get nourished, to function better, to perform better. So sensations are the food for brain. Now, which are the sensory systems which are required, which provides nourishment to the brain? Sight, sound, taste, smell, touch. 5 sensory systems we all know, but there are 2 more sensory systems which are required. Body position, that is proprioception, and your balance sense, your movement sense. These 2 sensory systems are very important. All these 7 sensory systems should get integrated in organized way, in smooth way, so that we can deal in this world, we can meet the situational demands. Tactile sensation. Tactile sensation is very important. It provides sense of touch. It builds basic blocks for body awareness. It gives information regarding texture, size, dimensions of the object. Then proprioceptive system. What it does, it provides information or position of our body parts and relationship of body parts to each other. It helps her to make sense of touch and movement experiences, and it closely integrated with our sense of touch. Vestibular system. Our vestibular system is the primary system, which is very important system. It gives sense of balance, sense of movement, gravity, changing head position, whether we are moving, whether we are sitting still. It provides all this information. It stabilizes our eyes when we are moving, modulates our muscle tone, our posture, and maintain our balance. So vestibular system is primary system, and these 3 systems are very important. So the integrative process, the neurotypical brain development happens. The touch sensation, during first few months of life, the touch sensation like sucking, swallowing, mother-infant bond is formed, which gives emotional security. It is because of the tactile sensation. Then slowly the vestibular and proprioceptive sensory systems come in the picture. The child starts rolling, holding his head, the posture and balance develops, the tone develops. So these three sensory system gets integrated. Then the child starts exploring through crawling, through walking. So child is developing the body map, the balance in standing, balance in walking. Child is able to plan different activities like when he's or she is playing with the toys, he's learning many things which improves the activity level, gives attention span and emotional stability. And the third level, along with touch, vestibular and position sense, auditory and visual sense come in the picture. They start working with each other in integrated way so that child is able to speak, child is able to uh, communicate, child is able to know the meaning of the words he is speaking. So all these sensory systems get integrated, and now after first few years, the first 2 3 years, child is able to function as a whole brain, ability to concentrate. Child starts going to school, the self confidence develops, the self esteem develops, and the higher intellectual functions happens. So first few years are sensory motor development, which is important for your intellectual functions, for your academic development. The first few sensory motor development, first few years are very important. That is why sensory integration is important for your future development. Now, traditional SI theory focuses on these three sensory systems: touch sense, position sense, and balance sense. Why? Because these are body-centered senses. They are among the earliest sensory systems to develop, relay information about body and its boundaries. And they are very important, as I said, for your future development, for your motor development, for your language development, and your other skills which are required later in life. Sensory integration, sensory integration begins in the womb. How? At the 5th month of your gestation, when fetus is developing, 5th month of gestation, your tactile system, your position system, and your vestibular system, like the movement sense, they have already matured and have started working. Child, the fetus in the womb notices mother's movement. That is, movement sense has already started working in the womb. Sensory integration during first year of life is very important because the enormous amount of sensory integration is happening during crawling, during standing, as the child explores the world, as the child speaks, as the child plays with the toys. The child is learning every movement. The child organizes sensation of his body and gravity along with sight and sound. Children develop skills through play. That's why play is very important, and the play is important part of sensory integration therapy. Sensory integration occurs during moving, talking, running, playing, forms a groundwork for your intellectual functions, your academic skills, your reading, writing, and they are very important for your emotional stability and for your good behavior. Now, we have seen why sensory integration is important. It is important for your normal development. But what happens exactly in autism spectrum, and why in autism spectrum the sensory integration is affected? As we know, it's a developmental disorder which affects the communication and behavior. There are persistent deficits in communication. Child is not able to communicate in to and fro. The communication is affected. Child is not able to interact with peers, not able to interact with parents, not able to give eye contact or point things, not able to express his needs. Child prefers solitary play, playing alone gives him or her safety. So this is persistent deficits in communication. And there is other things which are seen as restrictive repetitive patterns and interest. So child is obsessed, or child is clingy to certain objects, child is likes to see fans, ceiling fans, or circular objects, or wheels. Child has a sameness in his play. There is no meaningful play, or there is no creative play. Child is not able to play with all toys constructively. Child likes to line up toys or make tower repeatedly. So child is getting engaged in the restrictive repetitive patterns of behavior. And why it is called spectrum? Because it is wide range, wide variation in type and severity of the symptoms. That's why it is called spectrum. Now, as we all know, causes of autism, like there is genetic environmental interaction during first few years of life, prenatally. The development affects prenatally and first few years of life. So the genetic alterations while the child is or baby is developing in the womb, what it exactly does, it affects the fetal brain development. There are widespread abnormality in brain structure and function. There are poor neuronal connections are formed, poor neuronal networks are formed. The two parts of the brain are not connected with each other. The sensory part of the brain is not connected with other parts of the brain properly. There can be poor conductivity, which takes place, and that's why child or children with autism is they're not able to register the information in smooth way, in integrated way, in organized way, because of the structural changes or structural abnormality changes in brain. Specific areas which are affected, which are very important for sensory processing, are limbic system, corpus callosum, parieto-occipital temporal lobe, these and cerebellum. These parts of the brain are very important in sensory detection, in sensory processing, in sensory modulation, that is filtering out the sensory unimportant information and processing the important information. And cerebellum, as we all know, it is important for your coordination. So these specific areas are affected in autism, and that is why we see many different sensory integration dysfunction in autism spectrum disorder because of the structural brain changes, and brain is not able to function fully. Brain is not able to process the sensory information which is coming to child's body from the environment and from his or her own body. The child is not able to regulate and process and interpret this sensory information. So there are many sensory symptoms which we see, like there are over responsiveness to certain sensory stimuli, and there are under responsiveness to certain sensory stimuli. These are called modulation issues. Like child is not able to interpret the information, and that is why child is sensitive or hyper responding to certain sensory stimuli. Sometimes child is able to regulate the information. Sometimes child is not able to register the information at all. Child is not able to process the information at all. So he is not responding, or he is under responding to certain sensory stimuli. Sometimes the child is not able to interpret and under responding to certain sensory stimuli. So child wants that sensory input again and again, and child is craving. So we can say child is seeking that sensory input. So these are sensory modulation issues. I'll be talking in detail about these issues. But because of the sensory affection, sensory part of the brain is not able to interact well with the motor part of the brain. There is no interaction between sensory and motor connections. So we see motor problems. We see motor planning issues, that is called dyspraxia in autism. Why we see motor planning? Motor planning requires ideation. What to do? What I have to do? What should I play? So ideation and motor planning. How should I do it? If child wants to play with the shape sorter, child is thinking that I want to play with the toy, I want to play with the shape sorter. What I want to do? But how should I play with the shape sorter? That child is not able to understand that. Child is not able to plan how should I play with these shapes? What should I do with these shapes? So that is why they are not able to plan the action. So rather than putting shapes in that particular shape sorter, child starts to line up those toys or line up those shapes or make tower with the shape, because he is not able to plan that action properly. So because of the sensory affection, we get motor planning issues in autism spectrum. As I have already explained, what is hyperresponsiveness and what is hyporesponsiveness. So when the child has tactile dysfunction, like touch, child is not able to process the touch sensation. Child is defensive, child is aversive, child is sensitive to that tactile stimuli. So what will be the signs which we see? Child is not able to go in barefoot. Child is not able to participate in messy play. Child pulls away from light touch. Child avoids wearing different new clothes, the clothes which has labels. It bothers the child. Dislikes eating messy food. So the child, if you are imposing the touch stimuli to the child is getting away from that because child is not able to interpret the touch sensation in meaningful way. But at the same time, child can be under-responsive to touch sensation. That means they are not able to register the tactile inputs which are coming from external world and coming from the inside of the body, and are not able to register. So there is poor registration. Child is not able to understand. So that time child might craves the sensation. Child is seeking the sensory input. Child is likes to explore. Child likes messy play a lot. Repeated participation in messy play. Then child likes to put things in mouth. Child likes to touch different surfaces because he wants that tactile feedback again and again. Now, when there is position sense dysfunction, the child is not able to uh, understand the body parts, relationship of body parts, where my hand is, where my body is, where my foot is. So child is not able to understand the position of the body, position sense, along with tactile sensation. Child is not able to integrate the position sense along with tactile sensation with other sensory system. So what it creates, it so child becomes clumsy. Child has low tone, cannot sit at one place. Child likes to bang, child likes to jump, hit other, push other. So again, he is seeking, he is craving for that position sense. Now, in movement sense, that is, we know vestibular dysfunction, like movement sense dysfunction. So what do you see? In that child is not able to understand the movement which is happening, the head movement, the body movement. Child is scared to sit on the swing. Child is scared to step on the ladder. Child is very scared to jump from the height because there is no gravitational security. Child doesn't feel secure when he or she moves. So child is very scared to do all the physical activities and he prefers sedentary play. Then next, poor registration. So movement sense, there is hyper responsiveness, which we see. Now there is poor registration of those inputs. So in poor registration, what happens? Child is the postural control, the movement sense. It is important to control your postural tone, to control your tone when you're moving, when you're standing, when you're uh, walking, when you're climbing, when you're running. So that postural tone is low. Child repeatedly falls while playing, while running, while walking. Child falls down. Child is not able to regulate himself while doing the physical play. So again, child prefers sedentary play, or child might fall repeatedly, or child is not able to use both sides of the body meaningfully in coordinated way. So there will be issues with cycling, or there will be issues with ball catch throw, or there will be issues with handwriting where you need coordinated hand movement with both sides of the body. So child will be having problem with that because child is not able to process the movement sense, tactile sense, and position sense. So as we all know, these three sensory systems are important, but along with they work with vision and auditory. So what are the visual symptoms which we see? If child is not able to understand or interpret the visual information, child likes to steam a lot, child likes to look at the fans, child likes to look at the wheels, they are fascinated with circular objects, and they are not able to interpret the visual information, and at the same time they are not able to work with other sensory system. Now visual system works with movement sensory system, they work together. So our eyes are stabilized when our head is moving, eyes are stabilized because my visual system is working with the movement system, but there is no interaction, there is lack of interaction between those two sensory systems. Both the sensory systems are not working functionally fully, so child is not able to interpret the body movement. At the same time, child is not able to interpret the visual inputs also. So visual perception is highly affected in autism. When child is looking at you, sometimes child will over register your facial expression, sometimes child will not register your facial perception. We don't know how the child is able to interpret the visual perception or visual inputs. Auditory, again, many auditory signs and auditory dysfunction happens in autism spectrum. The autistic child is they maybe avoid crowded places, or they may avoid going to mall where there is lot of noise or lot of music. They are not able to again regulate the auditory information. It becomes when child goes to mall or child goes to crowded places, the sound becomes overwhelming for them, and they cannot process that sound of the auditory input very well along with other sensory system, so it creates anxiety. That's why the anxiety creates flight and fight situation, and they wants to run away from that situation. So they avoid going to birthday parties, they avoid going to crowded places. In children, those who have auditory defensiveness, auditory over responsiveness, they usually get distracted by loud noises. They cannot function or focus well in the school also, because many children are maybe they are talking, some children are crying, so they are not able to function properly. They may be able to function in quiet room very well. Some are over responsiveness. At the same time, there can be under responsiveness also. Child is not able to, when you call his or her name, child is not able to process that auditory input at that time. That's why child is not responding when name is called. So that can be under responsiveness to auditory input. Sometimes it becomes fluctuating situation also. Throughout the day, the sensory systems, they are fluctuating. So in the morning, the autistic child can be over responsiveness or shows over responsiveness to certain auditory stimuli. In the afternoon or in the evening, he or she might be craving for the sensory input, craving for the auditory input. So at that time, he likes to sing or hums or bang object or seeks loud music at that time. So it can be fluctuating throughout the day. Along with visual auditory, we have gustatory function and olfactory, that is smell and your taste sensation. So when there is dysfunction in smell and taste sensation, the child smells the few certain smells and taste can be overwhelming for the child. Child avoids certain food taste, certain food textures, has poor appetite, gags easily. That is very prominent in autism spectrum, because child is not able to again interpret or regulate the smell and taste sensation. And sometimes there can be craving, they crave for certain, they seek some certain taste repeatedly, because after eating those food items they feel calm or they feel satisfied. So or crave certain taste, mouthing objects, they try to put things in mouth, again that can be calming for them, that's why they are doing that. So these are the sensory dysfunction which we see, and child is not able to regulate, and that's why child is either over responsiveness to certain or responding to certain stimuli and under responding or craving for certain stimuli. As we all know, because of the sensory dysfunction, there is planning, motor planning is also affected, and slow, inefficient motor planning. And because of the slow, inefficient motor planning, many kids, those who have neurodiversity, those who have autism spectrum disorder, they have difficulty in doing daily activities like brushing, how to take brush in hand, how to brush their teeth, then they don't know how to wash their hands, then grooming like wearing clothes, removing clothes, buttoning, unbuttoning, tying shoelaces, handwriting. All these skills require coordination of both sides of the body, and all these skills require smooth and organized integration of touch system, of position sense, of movement sense, along with your sound and vision. So if the sensory integration hasn't happened in the first few years of life in smooth way, in purposeful way, because the brain is not structurally, there are abnormalities in brain, and brain is to not able to function, not able to process those sensory systems, then child will be having problem with motor planning, like how to use scissors, the handwriting issues. Child is not able to ride a bicycle, or removing wearing shirt, as I've already explained. Then using both sides of the body in purposeful way, like catching, throwing ball, hopping, skipping, writing work, cycling, cutting, all these activities which require coordination of two sides of the body, they are not able to do. So now we will be talking about what is AS sensor integration therapy. So AS sensor integration therapy, sensor integration was proposed by Jean Ayres in 1972. She was an occupational therapist, and she said it's sensor integration is a neurological process that organizes sensations from one's body and from the environment, and it makes it possible to use body effectively in the environment. So, sensory integration theory proposes that sensory experience, which is very important in sensory integration therapy, invite the action and active participation. When you provide sensory experience in sensory integration therapy, it invites active participation of the child, which influences the child's nervous system, and subsequently the behavior of the child. Child is able to self-regulate, a child is able to participate in everyday tasks and activities. So in sensory integration therapy, three things are important. The central idea is to provide and control sensory input. Successful response, we see it's a adaptive response. We see adaptive response is a successful response to the environmental challenge. So adaptive response is very important in sensory integration therapy. So air sensory integration therapy offers the sensory input, which is given by therapist or controlled by therapist. Child interacts with that sensory input. Child interacts in the environment given or provided by the therapist, and child shows the adaptive response. Child interacts in meaningful way, in purposeful way. So the intervention is successful, and intervention is guided by child's interest. So when we treat the child with autism, so there are many behaviors which can be sensory, which cannot be sensory always. Child wants to communicate, child is trying to tell you something, child might be hungry, child might be thirsty. So all behaviors in autism, they are in the form of communication. Child is trying to tell you something. So first you need to understand what child wants, why child is showing this behavior, whether child is thirsty, whether child is hungry, whether child has sensory need, or child want to escape from the situation, what is actually happening with that child. So our goal is to determine what exactly the child is trying to communicate, what exactly child is trying to tell you. Once you understand that now child wants these kind of inputs, or child is jumping a lot, child is anxious, or child is not able to regulate at that period. So child wants to jump on the trampoline. It's okay if you provide that jumping input, if you provide that position sense, proprioceptive input, child, after some time, child feels regulated. And then you can direct child to the things which you want him to do, to the task or to the academic task which you want him to do. So when you start your session or during the session, continuously we have to see child's interest, what child is trying to communicate, why child is showing that behavior, and whether our goal is getting fulfilled or no. So possible, as I already mentioned, possible problematic behaviors can be child is either want something or say, want some sensory input, child is not wants to escape from the situation, or child wants your attention. But all behaviors, they are a form of communication. Always remember, child is not able to express verbally, but through the child's behavior, he or she is trying to tell us something which we need to understand. So in assessment, in sensory integration therapy, we do observational assessment like problematic behaviors. We see play of the child. So play, looking at play of the child is very important, whether child is able to play constructively, child is able to play meaningfully with the toys, what are child's favorite toys, what are his preferences, what the child doesn't like. We need to see, we need to make a note of all these things because we need to use all this information during our therapy sessions. We take sensory profile, structured and unstructured observation. We take home videos also, how child is behaving at home and how child is behaving during therapy sessions or during therapy in therapy center. We have to see that sensory preferences and what are the problematic behaviors and what are the parents' concerns. These are very important to understand before starting your sessions or before dealing with any child. So, as during therapy, we provide sensory experience and we see child's response, how child is improving, how child is responding to the situation, and accordingly, we change the sensory environment or we change the environment. But some sensory strategies can be given at home. These are called sensory diet. So, as we eat food every 2 hourly to nourish our body, we need sensory diet. We need sensory strategies to be done every 2 hourly so that it can nourish child's brain. In autism, child may require repeated stimulation or repeated sensory strategies which can be done throughout the day. So child feels regulated, child can attend to commands, child can focus better. If a child is doing academic work, then child will be able to focus better if he or she has done some sensory work before the sitting activities. So sensory diet is very important when you prescribe sensory strategies at home. So as I have explained, there are sensory strategies which are very powerful and satisfying. These are movement, deep touch pressure, and heavy work. Other activities which are less satisfying and less powerful, which can be done repeatedly, like sucking, blowing, chewing crunchy food. If child wants some visual inputs or smell experiences, you need to give throughout the day. But powerful and satisfying sensory activities are movement, like throughout the day, you have to plan the movement activities for the child. Then deep pressure touch, deep pressure massage, those all those has effect on brain. It has calming effect on brain. It calms our brain, calms down the overwhelming response which child is facing or child is anxious. The deep pressure touch calms the child down, and so that the child can focus better and attend to commands, whatever we are giving. So those sensory strategies, but it should be fun activities. Those should be fun activities planned according to child needs. Each and every activity we cannot give to each and every child. Every child, each and every child is different. His or her needs are different. Today it will be different, tomorrow it will be different. So you cannot plan activity, whatever you are giving for 1 week. Throughout the week, you cannot give the activities. You need to plan the activities every day. Every day, child's response can be different to different activities. So you need to plan accordingly. So what are the home sensory interventions which can be useful for the child? As I said, if child is over responding, if child is anxious, child is not able to sit at one place, child is very restless, child is cranky. So just deep pressure activity can calm the child, can soothe the child. If child likes deep pressure with the hand, or just giving pressure with the pillow, or if you have a gym ball, just moving gym ball on his or her body can be peaceful or can be calming for the child. Or sandwich between the two pillows is also helpful for the child. And inhibition throughout the day, that means you can give chew tube, you can give blowing bubbles, heavy work activities like push, pull, hugging teddy bear, sandwich between two pillows, moving ball over the body repeatedly, sitting in sensory nest, which has visual effects, or smelling experiences which child likes, which soothes the child. You can give those experiences throughout the day. So some activities you can plan with deep pressure and touch activities. Some can be oral activities, and some can be smell experiences, or just auditory input, like if child is able to if child is allowing to put headphones, then child can listen to the music. That can be calming for the child. So these are the strategies which the children which are over responding to certain sensory stimuli, these activities throughout the day usually help to calm the child down. It reduces their anxiety, it reduces their stress. If child is going to the new environment, or child is going to the school for the first time, then these strategies can help the child to regulate in the school or to regulate in the classroom. Child which are under responsive, child is not able to register the sensory inputs very well, so they are seeking the sensory inputs. So you need to provide all the touch sensation, position sensation, and movement sensation repeatedly, so that child feels again regulated. So playing with play-doh, sand play, messy play, playing with finger pens, use different textures, moving different textures on his or her body, washing activities, rolling on texture mats, rolling on grass. All these activities will help the child if child is seeking the sensory input. Then, if the child is seeking the vestibular or proprioceptive activities, the swinging, bouncing, spinning, child wants that feedback. If you make the child sit on the chair, and the office chair, and if you spin the chair, the spinning experience can be fun activity for the child, and it can reduce the craving response or seeking response for the movement, and child feels settled. Child sits at one place for the sitting activity. So swinging, bouncing, spinning on chair, jumping on cushion, rocking chairs, the scooter board activity, hanging on trapeze. So all these activities you can plan in the evening period. Like if child is going to garden, child is running, jumping, spinning on chair, scooter board, or hanging on trapeze. All these activities can be planned during evening time, so that at night child sleeps properly. Child's energy is channelized somewhere. Again, position sense and movement sense, they work together. So crawling, climbing, pulling, pushing activities, heavy work activities, push the furniture, pull the chairs, heavy work, you can ask the child to lift heavy work and take it somewhere. So all these activities will regulate the child, will help the child to settle, to sit for a few minutes for setting activities or academic work at night, and child may sleep better. So these are the home sensory strategies which I wanted to talk about. Then these are the, so as I said, all behaviors, they are form of communication. So you need to understand what child wants to learn, what child wants to do, and accordingly, you should provide all the sensory systems or all the sensory inputs so that child can interact with you properly, child can sit with you properly, and so how the sensory integration therapy helps? Sensory integration therapy improves the interaction of the child. It can improve the eye contact of the child. Once the sensory input is provided, child feels safe. So child is able to play with you properly, child starts playing with the toys constructively. It affects your language development. Overall behavior of the child improves a lot with sensory integration therapy. And when you are treating children with autism spectrum, then you can combine 2, 3 approaches. That sensory integration therapy approach is important along with other therapy approaches. You can combine 2, 3 approaches, and while interacting with the child responds very well and child shows good improvement. Thank you. So, I hope you have understood what is sensory integration, why sensory integration is important, and why the children with autism, they have sensory dysfunction and not able to interact very well or not able to behave properly because they have sensory overload and they are not able to process the way it should be get processed, and that's why they are facing those issues. So if you provide the sensory inputs, if you provide uh, uh, other strategies with affection, with love, with kindness, these people or children, autistic children, they definitely respond in meaningful way, in purposeful way. Okay, so we have a question. Explain more on vestibular ocular reflex. So again, as I have explained, the vestibular system works in close relation with your visual system. The vestibular system is located in your inner ear. The inner ear, when your head moves or when your body moves, the vestibular uh, the vestibular system picks up those sensory inputs and they travel to the brain stem, then they travel to your higher parts of the brain, and those inputs get registered. When your head is moving, your eyes are also moving. So your sensory inputs from your eyes again gets registered at higher centers. So when you move your head, your eyes move in opposite direction. When you're moving your head in right side, your eyes are moving in left side. So the gaze or the eyes are stabilized on the object. So object gets stabilized on your retina and the visual perception is clear. So that is called vestibular ocular reflex. They both work, vestibular system and visual system, they work together so that when we are moving or when my head is moving, my eyes are stabilized. I'm looking at the camera, but my head is moving. Why it is possible? Because of the successful integration of vestibular and ocular responses together. I hope I have answered your question. Anyone wants to ask anything? Okay. So thank you, Autism Connect, for giving me this opportunity. And yeah, see you.